Hi, it's Dr. Charlotte Hodges, and today I want to talk to you guys a little bit about some of the symptoms that you might experience a little ways down the road after your weight loss surgery. These are not uncommon symptoms, and there's certainly things that a lot of my patients will bring to my attention after they've had surgery. I've recently made a video on flatulence, which a lot of patients have found very helpful whenever I've given them some of these tips. While this talk is going to contain a little bit of information about bloating and gas, it's really going to be directed towards other disease processes that these symptoms could actually be directing me towards. So it's not uncommon for patients to see me after surgery and to complain of some mild reflux. I put all of my patients on an anti-reflux medicine such as omeprazole. I really like Dexalant, but actually any proton pump inhibitor is going to be a good option. The recommendation is you need to go on a PPI for 90 days after surgery, and that really helps to decrease your risk for developing an ulcer kind of along your staple lines. It's not really to keep you from having a reflux. But what do you do after surgery? It's after the 90 days, and now you're beginning to have some pain kind of in your mid-chest. That could mean a couple of things. Number one, it could mean you have reflux, so you just need to continue to be on your acid blocker. Number two, it could mean that you have an ulcer that's developed. Typically, in my practice, I will just treat you empirically for an ulcer. I'll give you an acid blocker, usually twice a day dosing, so you kind of up the dose. And then I'll also give you medicine called Carafate to kind of coat your stomach. And I also direct my patients to avoid things like spicy foods, citrus, and clearly no smoking. Some things that can predispose you to developing an ulcer would be if you're a smoker, if you vape. Yes, vaping is just like smoking. Do not vape. Also, if patients are given systemic steroids, it's not uncommon for patients, especially in the fall, they get an upper respiratory infection and their doctor will give them an antibiotic and a Medrol dose pack or some prednisone. Anytime that you are on a steroid, that predisposes you to developing ulcers. So the two biggies are going to be smoking and steroids. So if I suspect that you might have an ulcer, I'll put you on medication. You can always do an EGD. That's an upper endoscopy where you put a camera down your mouth and I'm looking at your esophagus and stomach. That can give me an exact diagnosis of an ulcer, but it's not necessarily going to change your treatment. So sometimes patients can present with those symptoms. The third thing that pain in your mid-chest and bloating can also mean is it could mean that you're having biliary disease or gallstone disease. Your gallbladder lives underneath your liver, and it is in charge of collecting bile that the liver creates, it makes, and then the bile gets released down a little duct into the gallbladder. The gallbladder holds it, concentrates it, and whenever you eat, it squeezes out the bile, goes down a common bile duct into your small bowel, and then you're able to digest some of your foods. And bile particularly helps to digest fatty foods. It's not uncommon for patients to develop gallstones after weight loss surgery. About 30% of patients will develop stones. Now, let's say you're starting to have some bloating. You're starting to have a little bit of pain in your mid-belly. Even though the gallbladder lives on the right side of the abdomen, you can still kind of have this generalized pain after you eat, and particularly after you eat fattier foods. My first thing that I will do for my patients is I'll put them on acid blocker to treat them empirically for an ulcer. And then if some of the symptoms sound like somebody might have gallbladder disease, I'll get an ultrasound. If it shows stones, sludge, thickening of the gallbladder gallbladder wall, then that generally means that you're having pain secondary to gallbladder disease. And the only treatment for that is going to be surgical. You have to have your gallbladder removed. What I always counsel my patients on is only 30% of patients will develop gallstones. after surgery, so it's not routinely removed after surgery. And of those 30%, maybe only another 20 or 30% ever really even need to have their gallbladder out. There's always going to be different precautions that I give my patients. And please know in this video that if you are experiencing pain, I want you to present to your physician, present to your surgeon, so that they can give you a proper workup. This is not to substitute for any medical advice that you may be getting from your provider. If you're having pain, if you're having some of these symptoms, you do need to be worked up by your surgeon or PCP for the best care. So in closing, if you are experiencing, after you eat, some pain, some gas, some bloating, it could be reflux, it could be an ulcer, it could be gallbladder disease, or it could simply be because you're eating too big of a bite and eating too fast. So you may just have to slow it down, take smaller bites, and chew a little bit more. So I hope that this helps you guys with some of these symptoms that you might be experiencing after surgery. I wish you guys the very best of luck, and stay healthy and drink your protein. If you found that this video was helpful, please give me a thumbs up. Make sure that you follow me on my YouTube channel, and I look forward to talking with you guys soon. Bye.